The topic is hepatitis B. Hepatitis B is caused by a virus and it can cause damage to the body organs, including the liver. It can lead to liver damage, cirrhosis, cancer of the liver, end-stage liver disease, death, and other cancers. The hepatitis B virus spreads from person to person when their bodily fluids touch. It can be through sexual activity or sharing needles or from mother to baby or blood. People can feel like they have the flu symptoms, nausea, pain in the upper or right side of the abdomen or belly, yellowing of the eyes, or jaundice. Symptoms usually get better, but it can take weeks to months. For most people with hepatitis B, liver damage gets better within 6 months, but 1 of every 20 adults who get hepatitis B has the disease for a long time, and that is chronic hepatitis B. Most people with chronic hepatitis B have no symptoms, but over the time, the infection can cause damage to the liver and other body organs. One of the things that hepatitis B can damage is the liver, and it can lead to fibrosis or cirrhosis, which is scar tissue in the liver, which can then lead to cancer, liver failure, death. Symptoms of cirrhosis may include swelling of the belly, ascites, swelling of the legs, or fluid buildup in the lungs, bruising and bleeding easily, trouble breathing, feeling full, confusion, coma. Hepatitis B can be acquired mixing body fluids with other people. There are different ways that people can acquire hepatitis B. They all involve mixing of body fluids with other people, having sex with someone who is infected, sharing drug needles with someone who has the infection, using infected needles for tattooing, acupuncture, or piercings, sharing toothbrushes, razors, or other personal items with someone who has the infection. It can be passed from pregnant mother to the baby. There is a blood test that helps with the diagnosis of hepatitis B. The person should be tested or screened at least once. Some people will need to be tested or screened more than once. The person should be tested even if they have no symptoms. The blood test can also help determine if the person has a current infection or a past infection, and it helps to determine whether treatment is needed. There may be some testing needed to determine if there is liver stiffness or what level of damage there is. There could be a liver ultrasound done or a fibroscan. In some situations, a liver biopsy may be needed. Most people with acute hepatitis B do not need treatment. The body usually gets rid of it by itself within 6 months. Chronic hepatitis B, which means that the infection has been in the body for 6 months or longer, might or may need to be treated. It is important to discuss with the doctor if treatment is needed right away or if it can wait. The treatment includes an antiviral. The person may need that medication for years or lifetime. It will help prevent worsening of the infection. It suppresses the virus, and it will help prevent worsening of body and liver damage. Some people may need an ultrasound every 6 to 12 months to screen for liver cancer or hepatocellular carcinoma. People with hepatitis B are at risk for certain lymphomas. They can also develop kidney problems and other systemic problems. People should avoid alcohol. They should get vaccinated against hepatitis A, influenza, and pneumonia. They should also discuss with the doctor any over-the-counter medications. Hepatitis B is preventable with the hepatitis B vaccine. The person should use condoms, avoid sharing toothbrushes, razors, needles, syringes. Person should use bandages to avoid or cover cuts keep the area clean, especially from blood. Hepatitis B does not spread through cough, sneezing, hugs or kiss, or eating utensils. If the person gets pregnant, they may need medication to prevent passing or transmitting the virus to the baby. The baby may need some additional shots right away when born to prevent getting the infection, and the baby should also get vaccinated against hepatitis B. I hope this topic was helpful. Thank you.